Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At BluZone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit BluZone.health and take the first step towards stronger lungs and a healthier future. BluZone Health. Breathe better, live better.
Good evening, everybody. We're back in the Cozy Lung Lounge. I've got my friends with me, and we're on episode 28. That's been a lot of talking.
Hey, everyone. It's Amy.
Hey, everybody. It's Kelly.
It's nice to see you all. Episode 28, we're going to talk about how to talk to your doctor. And this is something that I deal with every day, and talking about with coaching clients and with pulmonary function patients that I'm doing. What do we need to know about talking to our doctor?
Well, I think what happens to a lot of people is you go in with a mental list of things to talk about, and as soon as you get in front of the doctor, you go blank. So I think it's really important to write down all of your concerns, all of your questions and everything. Just have it either on a piece of paper or on your smartphone. And there's a whole lot of things that you could ask your doctor when you're there. But one of the things with COPD that I tell my patients to ask is, ask yourself first, are you as active as you want to be? Are you able to do all the things that you want to do? Whether we're talking about walking to the mailbox or doing a grocery store run or working out at the gym or doing a class or something, no matter what that is, are you as active as you want to be? And if not, why not? In other words, what happens? Do you get tired? Do you start to have pain? Do you feel like you don't get enough oxygen? Do you just get entirely too breathless to do it? That's something to tell your doctor, to say, I really would like to be more active, or I really would like to do these activities, but here's what happens when I do.
I definitely think it's good to have a little bit of self-reflection when you go to the doctor. And that's something that not everybody always thinks about when they go to the doctor. And I like kind of what you said, are you as active as you want to be? Thinking about, am I doing the things that I want to do? Is my health getting in the way? When you're making that journal or health log, like you talked about on your phone or on a piece of paper, it's good to take a look at maybe some symptoms that you've noticed that have gotten better or worse based on last time you went. You could keep an eye on your vitals if you like to take your oxygen frequently and maybe you've noticed a change. Or if everything's been the same, that's also a good thing to note with them. And then also just going through any lifestyle changes. So have you taken up a new exercise class, or have you become a lot more sedentary? Are you less active than you want to be? It's important to be somewhat detailed, but maybe not over the top with that list, to make sure that you've got the proper information for your physician so they can make the best plan for you.
That's a really good point, Amy. We talked about, are you tired? Some really broad things about your whole body. And that's really important because we don't want to presume the issue before the doctor is able to hear all of the symptoms and then make a decision. It might be your oxygen, but it may be that you're just not exercising enough. So there's things that need to be done before the answer is there. So make sure you have your list ready and all the symptoms that you're experiencing.
And sometimes it's a good idea, if you're not really sure about what to ask, take somebody with you. It could be a caregiver, a family member, a spouse, anybody. Just take somebody with you who might have additional questions on top of yours to ask the doctor. And then that will also help you remember what the doctor said.
I've had a couple of times this week where I've seen the patient after they've seen their doctor, and they're like, oh, I forgot this, or I forgot that. It's okay. It's not the end of the world. We have electronic communications nowadays. So all I did is I just sent a little email to the doctor about those concerns, and they were able to follow up later.
Another thing to prepare for that doctor visit, and I just did a podcast on this, is making a list of all of your medications. So medications isn't just your pills. Medications is your inhalers, any liquid medications you use in a nebulizer, and also any kind of over-the-counter supplements that you're taking and any herbs. This can also include, most recently, if you're taking some kind of a protein shake powder, they're putting heaven knows what in those these days, all kinds of additives and herbs and maca and superfoods and everything. And the last doctor appointment that I had, they said to me, bring all of your supplements with you in a bag. And I started laughing because I take a lot of supplements and I have a big thing of protein powder and a big thing of cachava that I put in my drinks and all this. I thought, oh my goodness, no, I'll just take a picture. So if you don't want to bring it all with you, take a picture of what it is that you're consuming that isn't just a regular everyday meal.
Something that we've talked about on previous podcast episodes that fits really nicely here is your action plans. You should have an action plan if you're a COPD patient, if you're an individual with asthma, or if you have bronchiectasis, and even interstitial lung disease. We've introduced action plans for all 4 of those. If you don't have an action plan for those, I'm sure we can link those in the show notes to each one of those. And even if you don't have a specific respiratory disorder, you still should have an action plan for your general well-being. You know that the doctor wants you to take a vitamin, maybe a blood pressure pill, and exercise 3 times a week. Well, that's an action plan for wellness.
And definitely the action plan for what if you get in trouble? What if you wake up one day and your chest is a little bit tight? Not enough maybe to go to the hospital, but what does your doctor want you to do when you're just not feeling like your usual 100% self that day? Maybe he's got some ideas, an extra dose on an inhaler. Maybe he sent you home with antibiotic or sent you home with some steroids. What does he want you to do? He or she wants you to do in that case?
There's a wide range of responses that you might get from the physician office, depending on the kind of practice that they have. Many of these ideal doctors that we talk about here on the program will get you in the office and discuss it with you and make sure that you're followed up with quickly. Many other offices just are overwhelmed with too many patients, and they may ask you to go to the ER or urgent care. All of those are valid choices.
And another question to ask the doctor is, are you going to change up any of my medications or inhalers, and why or why not? And what I mean by that is, if you are happy with your regimen, you feel like you're well controlled, you're hardly using your rescue inhaler, nothing's waking you up at night, and the doctor says, I want to try you on this new triple therapy drug. Why? If it ain't broke, don't fix it. Isn't that the saying? And why would they think that that's any better? And don't be afraid to ask, why do you want to change me? Or if you say, I don't really feel like this is doing it for me. I'm starting to get more active in exercise and I just feel like I'm pooping out halfway through because I'm breathless. And the doctor will say, we'll just keep going with what you're on. Why? Why won't you change me to something different to try? There's no harm in asking why or why not.
Absolutely. I feel like sometimes the biggest thing is just being your own self-advocate in those situations. If you feel like your doctor may not be listening to you, and if it really does become an issue, they're maybe trying to push new medications when you don't feel like anything's wrong, or if vice versa, they're not changing anything and you feel like they need to, it could be a good idea just to change physicians, if at all possible. If you've got another one in your area and you really feel like it's not meeting your needs, that would definitely be a good option to look into.
Hi, I'm Kelly, a registered respiratory therapist with BluZone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better.
Fun story from one of our BluZone coaching clients. She had this same situation, was going to go to the doctor and wanted to know what should we do. So we had a coaching session the night before her pulmonologist appointment, and we went through the action plan for her illness and talked about the different elements. What does a nebulizer mean? What is oxygen? When does somebody need oxygen? So that when she went to the appointment, she was prepared with the understanding so that she could have an informed conversation. And come to find out, that doctor was so impressed with that action plan, she spent more time teaching him than he was teaching her. So it really was a very positive experience. But yeah, going into those appointments prepared really can make all the difference.
And Amy, to tag on what you said, a lot of times we have our primary care physicians, and then sometimes, depending on what we have, COPD, asthma, IPF, we may go to a specialist, which is a pulmonologist. But anymore, there are so many subspecialties now and so many things going on with lung disease that your pulmonologist may not be really well versed in pulmonary fibrosis, or your pulmonologist may be a really whiz guy at COPD, but not in asthma, or, emphysema is their thing. It's become a subspecialty now. So as Amy said, if you need a doctor that's more geared towards your specialty, if you feel like you're constantly having to teach that doctor things, don't be shy, change doctors.
There are information registries on most large networks: COPD Foundation, Pulmonary Fibrosis Foundation, Asthma and Allergy Network. They have physician finders, specialty center referrals for all kinds of conditions. So reach out and search that condition. If you're not getting the answers at home, you may need to go to a larger referral center.
And I think another thing to ask while you're at the doctor is, am I due for any tests? That doctor should know, when was your last chest x-ray and what did it look like? They should know when you had your last pulmonary function test or spirometry. They should know when you had your last EKG. And maybe you get your annual physical at a primary care physician's office. And so those types of things, the EKG, the chest x-ray, the routine things, those items would be a good thing to take with you or make available to your pulmonologist, your specialist. And then any other tests that are due, a 6-minute walk test. I have so many patients who've never done a 6-minute walk test in their life. And I'm not talking about the little run around the office and see if you flunk and qualify for Medicare. I'm talking about, how much oxygen do you need to move for 6 minutes? A real 6-minute walk test. And again, don't be shy for asking. Just say, you know what, I don't think I've ever had this 6-minute walk test. Can you schedule me for that? And you would probably, if you have a respiratory therapist in your office or somebody that can do it in the office, great. You may have to schedule it with somebody like Gina or somebody who's outpatient and get that done.
I have so many stories this week about oxygen titration walks that I'll say for another day. But if you have low oxygen, please don't drive. You may think you can do well, but everybody else on the road needs you to have a full 100% brain with adequate oxygen. So just pay attention to that. We'll talk about that another Down in Oxygen podcast.
Yeah, let's do that one soon.
Well, speaking of, prepping for the doctor's visit, one thing that I want to ask you guys, which you may know a little bit more about, is what are things to do and not do in terms of food, alcohol, nicotine, all of that before you go to a doctor's appointment? Because I'm sure, they're going to be checking your vitals. They're going to be potentially doing some sort of testing on you, maybe blood work. What should you consider with that before you go in?
Well, I think pulmonologists, Gina, correct me if I'm wrong, but don't do routine blood work. I know when I go to my primary care physician, it's an excellent question, I don't eat, because just in case they want to draw a CBC or a blood or whatever they want to do, that way I can say it's a fasting test. I don't have to go back the next day. But pulmonologists don't routinely order CBCs and the like. I don't think so. But don't stop at Starbucks, because that'll send your blood pressure and your heart rate way up. Gina, what else?
You don't want to come to any tests under the influence, even though you think you might be, maybe relaxing or whatever, because it really can impair some of your judgment. And you don't want your physician looking at you and making judgments on your demeanor when you're under the influence of something. And that's alcohol, marijuana, or other sorts of things. Same goes for, don't go to your sleep study after drinking some beers. Make sure that when you're getting medical interventions, try to be at your baseline.
And if you're still smoking, don't smoke right before you get to the doctor's office, because that will affect your blood pressure again and your heart rate. And we want to kind of get a baseline and see where you are. I'm just trying to think of what else.
If you're scared of anything that the doctor has said, this is really where a health coach comes in. I'm finding time after time again, talking with patients that just don't understand what the doctor has told them. So this is almost an after the doctor follow-up. If you don't understand, write down those questions and either email the office, call the nurse and ask extra questions, or find a health coach like me or Kelly or Amy that can go through some of those concepts. Now, I'm not going to diagnose anything or tell you how to change your medicines, but I can tell you what the doctor told you to do and the rationale behind many of those decisions. Don't be scared.
Take a little notebook with you, a little pen and paper, and just make notes and just double read it back to your doctor and say, okay, if I'm understanding you correctly, you're telling me I need to do this. Or if I understand correctly, you're telling me I need to not do this. If I understand you correctly, you're telling me I have to go get this test, and this is how I prepare correctly for this test. And that way you've got it written down. And as Gina said, if you're not really sure why they want you to do the test or why you have to do all this strange preparation for whatever test that is, definitely you can talk with a health coach about it. Another one I know is don't eat a big meal before you're about to do a pulmonary function test, because that can affect your ability, your lung volumes.
One thing I've seen at some physician offices is kind of in the pre-preparation visit, bring something with you, a snack, some water, because you could have an extended wait time in that waiting room. Especially if you're diabetic, have a snack with you. I'd hate to have you out there for, an hour or two waiting on a physician that had been called away for an emergency, which does happen. So be prepared just in case.
That's a really good point. I always carry with me a granola bar, water, and anything else. If I know it's going to be a long day waiting, doing something, take a little cooler bag. They have those tiny little lunch bags. You can throw a cooler pack in there and put in snacks, hard-boiled eggs, yogurt, a cheese stick, something with protein, so you're not just running on carbs all day.
That's such an interesting list of snack ideas, Kelly. I think we're going to have a food episode pretty soon, aren't we, on the Cozy Lung Lounge?
I think we're up next for that one.
Very nice.
Well, one last thing that I'll suggest when we're talking about the doctor is, and I forgot to mention this earlier, but don't lie. Don't lie to your doctor. Don't lie to your pulmonologist. Don't tell them you've quit smoking, even if you haven't. Don't tell them that, you're exercising, even if you aren't. They're not there to judge you. They're not there to tell you and you're doing a bad job or scold you or anything like that. They're really there to help you and then to help you make the best decisions moving forward. So give them all the information and all the accurate information to the best of your ability as you go through your doctor's appointment.
I'm remembering my days when I worked in the emergency room and, just trying to get a gauge on what happened to somebody when they came in and asking them, were you drinking or were you smoking marijuana or anything? And having to say time and time again, we're not the police. We're not going to do, we just need to know so that we can help you the best way we know possible. Because if you've been drinking, we don't want to give you this drug, or if you've been smoking marijuana, we don't want to test you for this. And so it's just important. You may get a little mini lecture about quitting smoking or not drinking so much, but we're not there to judge. We're there to help.
Well, do you ladies have any other tips or tricks on how to prepare for your doctor's visit?
I really think just getting in a health coach appointment with one of the three of us, because every doctor visit is individual and personalized, and depending on what you have going on and the questions you have and how long you've had your lung issue, will dictate how the visit goes. And so just being armed with as much information as possible, and being given the license and the freedom to ask certain questions will really help you get ahead quicker.
Well, hopefully this helped you guys prepare for any future doctor visits you may have. So please feel free to reach out to us if you do have any questions, and we'll see you guys in the next episode.
Bye.
Bye.
Hi, friends. This episode of the Cozy Lung Lounge is brought to you by Hootenanny Joy, where your health and wellness take center stage. At Hootenanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootenannyjoy.com to explore the programs and choose the one that fits your journey best. Hootenanny Joy, because your health deserves a little joy.